Welcome to Final BDS MADC. Dental implant is one of the important 7-marker as well as 5-marker questions from the subject of oral and maxillofacial surgery for final year BDS exams. Starting with the definition, according to the glossary of prosthodontic terms, it is a prosthetic device of alloplastic material implanted into the oral tissues beneath the mucosal and or periosteal layer and a substance that is placed into and or upon the jaw bone to provide retention and support for a fixed or removable prosthesis. Classification of implants. Based on its placement in relation to the bone, they can be classified as endosteal, subperiosteal, and transosseous implants. Starting with the endosteal implants, these are implants that are placed completely within the alveolar and basal bone. These implants receive their support by osseointegration with the alveolar bone into which they are placed. They can be of different types depending on the shape that is used, blade type, root form type, etc. Next are the subperiosteal implants. These implants are placed just below the periosteum and rest on sound bone. Instead of penetrating the alveolar bone, they rest on its surface. They are inserted by a surgical procedure where the mucoperiosteum is reflected and the alveolar bone is visualized. The implant is made to rest on the alveolar bone with its posts protruding from the surface of the mucosa. These implants are indicated in case of an atrophic mandible where there is not enough bone for the placement of an endosteal implant. Last one is the transosseous implants. These implants are used in the anterior region of the mandible. It consists of a horizontal plate on which the body of the implant are fixed. Next are the indications for implants. They can be given in completely edentulous patient, partially edentulous patients, partially edentulous jaw with distal free end situation, single missing or extracted tooth, replacement of teeth in an edentulous jaw with opposing natural teeth, patient unable to wear a removable denture prosthesis due to parafunctional habits such as bruxism, gag reflex displacing the denture, patients are not satisfied with removable denture, or psychological causes preventing the use of a removable denture. And the last one is inadequate number of abutment teeth for the placement of fixed partial denture. Contraindications for implant placement. First one is unfavorable intermaxillary relationships. In patients with unsatisfactory intermaxillary relationships, implant procedure should not be considered. Problematic occlusal and functional relationships. Pathological conditions of the jaw such as cysts, tumors, inflammatory manifestations, etc. form temporary contraindications. Such patients should be re-evaluated after treatment of the jaw condition. Next is radiation therapy in the jaw region. Implantation is usually avoided in such cases due to compromised vascularity and likely damage to the cells and the associated problems with wound healing. Next one is pathologies affecting the oral mucosa. Leukoplakia and lichen planus contraindicate implant procedures. Next one is erostomia. Salivary flow has a cleansing effect and reduces the bacterial count in the oral cavity. Reduced salivary flow is a relative contraindication to implant placement. Next one is macroglossia. Temporary medical contraindications. Certain conditions affecting the patient may be temporary situations and serve as only relative contraindications to implant placement, such as acute inflammatory diseases or infections like sinusitis, bronchitis, etc., may be treated prior to surgical placement of implant. Then pregnancy. Surgical procedure is best avoided during pregnancy, usually due to stress factors and also because of the possibility of pregnancy-associated gingivitis. Next are medications. which include anticoagulants, immunosuppressants, etc. Treatment may be started after the medication has been discontinued. And poor patient compliance. The patient must be fully prepared for the procedure. If not, other non-invasive means of tooth replacement may be done. The general medical contraindications to placement of implants are general nutritional condition. Metabolic disorders such as diabetes and hyperthyroidism must be controlled prior to treatment. Hematological disorders such as anemia or any hemorrhagic diathesis represent absolute contraindications to the procedure. Cardiac and circulatory disease. The patient must be thoroughly evaluated prior to surgery and the necessary precautions must be taken to prevent any complications. Osseous and metabolic disturbances. Osteoporosis, osteogenesis imperfecta, etc. will hamper the success of the implant. Collagen disorders like scleroderma, rheumatoid arthritis, etc. represent contraindications. Dental implant has a potential bacterial focus. Patient with a history of bacterial endocarditis or with heart valve prosthesis presents a high risk of bacteremia due to the dental implant. Complications include the intraoperative such as hemorrhage, nerve injury, perforation of antrum, fracture of jaw, perforation into nasal cavity. Then complications due to improper placement include bone dehiscence, damage to adjacent teeth and lack of stability. Immediate postoperative complications include hematoma, edema, infection, wound dehiscence and mobility of implant. And late complications include peri-implant pathology, fracture of implant, sinusitis, nerve damage and mucosal irritation. Steps in the placement of an implant. First step is incision. A crestal incision with buccal releasing incision, buccally based flap or lingually based flap may be planned. The incision should be planned in such a way that after the implant is placed and the flap is replaced, it should cover the implant completely. Reflection of mucoperiosteal flap is the second step. Once the incision has been placed, the mucoperiosteal flap is reflected using a periosteal elevator. Care is taken not to buttonhole the flap. Care should also be taken not to strip the bone excessively, only as much as it is required to place the implant must be reflected to allow good periosteal cover for the bone for good healing. Third step is placement of the implant. First of all, the implant size is chosen based on the radiographic analysis of the amount of bone available. Care should be taken to choose the size of the implant which has a gap of at least 2 millimeters from all important anatomic structures and also the bone margins. The position and angulation of the implant as determined by the model analysis should be maintained when the implant is being drilled into place. A stent is fabricated with acrylic. This is placed on the alveolar ridge and the exact location of the implant is marked on the stent. A hole is then drilled in the stent in this accurate position and angulation. The stent is then used as a guide for the placement of the implants. Preparation of the implant bed is done using relatively high speed, maximum speed up to 2000 rpm standardized steel drills. The drills are made of specific sizes corresponding to the size of the implant. For minimal trauma, the drill is used with very slight axial force and under copious saline irrigation. During drilling, the drill is moved up and down to ensure adequate cooling of the bone that is being cut. Usually, the distance between two implants should be as much as the diameter of the implant when multiple implants are to be placed. Titanium instruments provided in the kit are used for this procedure. A thread cutter or a screw tap is next used to prepare the screw threads in the bone if a screw type implant is used. The precise sized implant is then inserted carefully using a wrench to tighten it till the surface of the implant is flushed with bone surface. Cover screws are placed on the implant body. These are placed so that the hollow cylinder of the implant is left intact without the growth of the bone or connective tissue into it. This allows the placement of the prosthetic part of the implant when it is uncovered. Fourth step is uncovering the implant. In a two-stage implant, the second surgical procedure is used to cover the implant after the healing phase. This is done usually about 3 months after placement of the implant in the mandible and after 6 months in the maxilla. This procedure can be done under local anesthesia. Various techniques may be employed: use of crestal incision in the middle of the keratinized mucosa and reflection of a buccal and palatal or lingual flap. This is followed by apical repositioning of the buccal flap. Use of tissue punch or soft tissue trephine for uncovering the implant. Electrosurgical uncovering of the implant can also be done. Once the implant is uncovered, remove the cover screw gently and test the osseous union of the implant. The peri-implant soft tissue is checked. Prosthetic treatment. The prosthetic replacement is fabricated to suit the occlusal configuration as decided by the model analysis. This is then fixed onto the transmucosal connector. The implant can now be loaded by masticatory forces. That's it. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.